You're listening to the Blockchain podcast.
Hello, and welcome to the Blockchain podcast. At Blockchain, we believe that blockchain is a technology that has the potential to empower billions of lives. But although the technology has gone mainstream, there's still a deep misunderstanding. And that's what Blockchain wants to do, is really to fill this knowledge gap and help people understand how blockchain technology can empower them. And that's what this podcast is also all about. We want to take this information, this kind of overwhelming topic, and bring it down to digestible, bite-sized information that the average Joe can follow along with. And today I am thrilled to be joined by Dr. Chang Lu. This is very exciting. We're going to dive into some very interesting healthcare blockchain topics. Dr. Lu has a PhD in strategic management and organization from the University of Alberta, where he's also an instructor for undergraduate business studies. He's also a postdoctoral researcher at Blockchain UBC, which is a research cluster at the University of British Columbia focused on blockchain technology and how this technology can be leveraged to improve the lives of Canadians and people around the world. And at Blockchain UBC, Dr. Lu is specifically focused on the adoption of blockchain in healthcare and the pharmaceutical industry. So, Dr. Lu, thank you so much for joining us today.
Thank you for having me.
Yeah, I'm really excited to dive into some of these topics. Before we get into all the cool stuff that you're working on, I would like to know kind of how you got to be here. Like, how did you find out about blockchain technology? How did you decide that this is something you wanted to research and dedicate your time to?
So I came across blockchain in 2017 during the ICO craze. At that time, I was just finishing my PhD. I was in the last year of my PhD, and I came across the ICO craze, blockchain technology. And at that time, my research was focused on institutional change and innovation adoption of innovative practices. And I heard that a lot of people made a lot of money from Bitcoin and cryptocurrency. So I was like, so this sounds interesting. There must be something, novel that is going on there. So I look at what a blockchain is and the philosophy behind it, the technical design behind it. I felt that this technology could represent a revolution to many industries. So because I was, interested in innovation adoption overall and institutional change, I thought, maybe I could look at blockchain adoption as an empirical context to answer some of the theoretical questions that I was trying to explore at that point. So I started reading about blockchain and listening to some podcasts and watching some YouTube videos. And then at some point, Professor Mark David Seidel from the Seidel School of Business paid a visit to University of Alberta, and he presented the work that Blockchain UBC was doing at that time. And I was at his talk, and after the talk, he mentioned that Blockchain UBC was looking for someone to study blockchain adoption in healthcare as a postdoctoral research fellow. At that time, I was finishing my PhD. I was looking for the next steps, and because I was already interested in blockchain, interested in innovation adoption overall, I thought, I should give this a try. So I met Professor Victoria Lemieux, who is the class lead of Blockchain UBC, and we had a conversation, and she liked my background. So then I just came to Blockchain UBC to study blockchain adoption in healthcare. So my postdoc research project was funded by MedX, which is a nonprofit organization in Canada that kind of helps connect academia and the industry and a pharmaceutical company in Europe. So the focus of my postdoc research project was to look at what are the organizational and institutional barriers for blockchain adoption in healthcare and what might be the pathways and strategies for adoption to happen. That project has been finished, and during that project, I published a few articles and book chapters about blockchain in healthcare. and also got connected with a lot of industry leaders in the blockchain healthcare space. I am very happy to share my insights with you guys today. And overall, I think that there are a lot of exciting ideas about blockchain in healthcare, and blockchain could represent a revolution to the healthcare industry. Could transform the ways in which healthcare data is recorded, shared, and managed across healthcare providers, healthcare institutions. But as my postdoc research project studied the barriers to blockchain adoption in healthcare, I also know that there are a lot of barriers before the adoption can really happen. Yeah.
Okay. And we'd definitely like to dive into some of those barriers as well. But before we do that, why don't you talk about the ideal case of blockchain in healthcare? Like, what does this technology offer to improve some of the inefficiencies in the industry? Like, what is the big value prop that blockchain has for healthcare?
Yeah. So one of the most transformative use case is probably a blockchain-based personal health record. So basically, we could, let's say, build a personal health wallet based on blockchain. The wallet will be something like a cryptocurrency wallet. But in that wallet, instead of having a cryptocurrency, you will have your medical history, like all your medical visits, all your doctor's notes, your testing results, your CT scan images, all of those kind of things, or even your genomics data, your genetic sequencing data. So basically, you have all your health data in one place in your wallet, and then every time you see a doctor, when a doctor adds data into your record, the doctor probably will have your record, but then that record will also be synchronized with your own wallet. So you will get constant update on your health data. And then your health data is always going to be up to date, and you know the most updated version, and you have a kind of an overview of your health status, and you know all your medications you have taken, and you know all the doctors you have seen, the different specialty doctors you have seen, and so that information in one place would make it much easier for you to, for example, switch doctors, right? Like, let's say, if you're not very happy with your family doctor and you want to switch to another doctor, and you can just share your wallet, the information in your wallet to the new doctor, and the new doctor will immediately have all your health information, or let's say if you have to move across jurisdictions from, let's say, BC to Alberta, then even in Alberta, the doctors will still have your entire medical history, which is not possible right now. It's possible, but it takes a lot of work for the medical records to be transferred across provinces, and by the same token, you can also when you have that healthcare data history in one place, it's also easier for you to move across countries. And then when you have that wallet, then you can share your data with anyone that you trust and you want to share. So, for example, you can share the data, let's say, with some, let's say, alternative medicine practitioners, whether it's acupuncturist or physiotherapist, who really don't have access to your whole medical history. But if you trust them, you can share the data with them, and they will have a clear picture of what your health status has been. And then you can probably also share the data with, for example, pharmaceutical companies, so that they can use the data to do some medical research to develop new drugs. And you can also share the data with university researchers, institutions, to help advance medical research. The beauty of that idea is that when the ownership of health data is placed in the hands of individuals, then that will reduce a lot of burden on the healthcare system. So right now, the healthcare system itself has to manage the health data of millions and millions of people, and lots of money and time are spent on those tasks. But if you actually distribute those tasks to each individual and let individuals take responsibility of that, then there will be less healthcare spending. And doctors won't have to spend so much time on administration tasks. They will spend more time on treating patients, and doctors will be happier, and that will be beneficial for the relationship between doctors and patients. So yeah, that's probably the most transformative idea or application of blockchain in healthcare. If that happens, I think that will completely change how healthcare works right now in Canada. But that said, it is the most transformative idea. To get there, we need to make a lot of changes in the system. Yeah. And so other than that, there are also some other use cases. For example, there have been some conversations about using blockchain to facilitate medical data sharing across institutions, across hospitals, across pharmaceutical companies. And there are also conversations about blockchain-based medical supply chain management, which I think probably is linked to your first podcast. And there are also conversations about blockchain-based medical credentialing. So right now, medical professionals have to get their license and renew their license every year, and go through like a lot of administrative procedures to maintain their professional status. And that takes a lot of work and time. But if you have, let's say, their credential in one place in a secured wallet, then probably they don't have to go to a certain agency or to a professional association every year to prove that they still have the status and they can still practice. Yeah, so all these ideas are kind of all these ideas have been proposed, and there have been a lot of discussions in terms of how to really implement those ideas. But I guess if let's say one day we can get all these kind of ideas realized, healthcare is going to become more efficient, cheaper, and more accessible to individuals.
Wow, inspiring. Yeah, I love that. And there's so many different layers there. Where to even start? The thing that really I think excites me the most is the first thing you were talking about, the our ownership of our own health records, self-sovereign data ownership, specifically healthcare data, which is like something that can really empower the individual, I'd imagine, especially in maybe some parts of the world that don't keep such accurate records as we do. I bet a lot of stuff gets lost there. And I've been doing some reading in this topic as well. And there's problems of security of this data also. Like right now, this data is being held by individual hospitals and offices and companies, kind of all over the place. And then there's been multiple data breaches, hundreds of millions of patient records stolen, sometimes things sensitive credit card and banking information, or genetic information, things that you're trusting these hospitals to safeguard for you, and then it's all exposed, and now these people are seriously vulnerable because of this, right? So this is a big thing that could potentially solve also.
Yeah, exactly.
And then also the kind of communication inefficiencies with the data sharing between all these different hospitals and institutions, right? Like you were talking about, because that's I know it's billions and billions of dollars in costs wasted, right? So by implementing blockchain, we can just really what blockchain offers is allowing us to do things cheaper and faster, right? Kind of in general, and it's a really good application here. So that is the I guess that's the possibilities of blockchain in healthcare, right? So now I'd love to talk about what are the realities of blockchain in healthcare. Today, what does blockchain X healthcare look like? Are we getting towards that vision that you described, or are there some roadblocks in the way? What are we talking about?
I think we are getting there slowly, very slowly. So a lot of the ideas I just mentioned were proposed around 2017, 2016, when Bitcoin price was really skyrocketing and when there were a lot of ICO events. So people started to look at what are the different applications of blockchain in different industries. Of course, the industry included healthcare. So people proposed all these kind of ideas, use cases, and organized the conferences. If you look at the website CoinMarketCap, at the time there were over 2,000 tokens that are healthcare related, and each token was associated with a blockchain healthcare project. But if you look at those tokens today, most of those tokens, probably 95% of those tokens have become dormant. So they are inactive, they're not being traded. And that means that the project behind those tokens probably is already dead, or it is stagnant. And then there are only probably a few, let's say probably a dozen of blockchain healthcare projects that are still active. But I really haven't seen a application that is being adopted widely by patients and physicians and hospitals. I think a lot of the few active projects are still kind of on the stage of, let's say, proof of concept, prototyping stage, and they really haven't really got, let's say, users sign up on their platform or application. I think that's the reality we have right now, and there are many reasons why blockchain has so much potential for blockchain in healthcare, but then in reality things are not moving as fast as let's say in finance or in supply chain. So first of all, healthcare industry is fundamentally different from finance. The basic difference is that finance is a very market-driven industry, and finance is probably where you will see the strongest force of capitalism. But healthcare is not about, first and foremost, at least in Canada, it's not about making money. It's about treating people, and it's about giving people care and creating well-being. So that's an industry where probably capitalism, at least in Canada, has the least footprint. Well, it's a different story in the United States, but in Canada, I think healthcare is much like a government sector, so to speak, and that makes a lot of the the initiatives or efforts or the mechanism that behind blockchain ventures, blockchain innovations, not feasible in healthcare. So for example, in the finance sector, if you want to do a crypto project, you could easily get, like, say, funding from VCs or from banks or private investors. And if there's a market appetite for it, then probably after passing through some regulatory hurdles, you can get your project implemented. And even sometimes without passing any regulatory hurdles, you can get your project implemented. Like, for example, Ethereum, Bitcoin, right? They just operate under the radar, and they can still have $1 billion business. But in healthcare, because there is such a strong governance force, and there is such a strong professional force, and there's little market force, at least in Canada, then let's say if you want to do a blockchain-based healthcare project, yes, you can still raise funds and all of that, but then after you raise funds, then you have to pass all those kind of regulatory hurdles. And each regulatory hurdle probably will take you 2 years or 3 years to pass, or even never, if you probably even your lifetime to pass. And before you pass those hurdles, you are already running out of money. And you cannot show any results or milestones to your investors, and then your investors will go away, and then your project is stagnant. Yeah, that's one of the reasons why in reality a lot of projects, blockchain healthcare projects, are not moving forward. And then the other reason, I think it has to do with the the structure of the healthcare ecosystem. So in the healthcare ecosystem, there are many powerful actors that basically operate independently, and they have so much authority and so much power to make decisions against each other. There are physicians groups. And within the physician groups, there are different specialties, and different specialties have their own associations. The physicians have their big association, and then you have the nurse association, and then you have the university researchers, university institutions, and then you have the health authorities. And yes, in the current system, they kind of work together in some way. Of course, there are conflicts from time to time, but they all work under the Healthcare Act. But that said, they are each of them is equally powerful. The physicians can make their decisions independently a lot of times from the government, and the government sometimes wants to implement some kind of a policy change. And they, of course, will consult physicians, but they also have their power to make their own decisions. So in that sense, you kind of have an ecosystem of field where different actors could potentially just operate independently without really interacting with each other or collaborating with each other. But to have a blockchain-based application, you almost every time needs to get everyone on board, because it is a peer-to-peer network, right? So if some actors want to get on board, but some others don't want to get on board, then it will take you a lot of time to persuade them, to convince them that they should also get on board. But maybe they don't want to get on board, not because they are against this technology, but because they are against some of the actors on the network, right? So then you will get into the deep water of politics. So that's another reason why blockchain adoption in healthcare is just so slow and difficult. And then I think the third piece is really kind of like the consumer, or let's say patient's receptiveness to this kind of new technology, or the new ways of doing healthcare with this kind of technology. So as patients, we are probably very used to the fact that doctors should take care of ourselves, right? Like, you just go to the doctor's office and get checked up, and doctors should do everything for you. They should know everything, and they should do everything for you. And I think in Canada, it's commonly believed that because doctors make so much money, they should, for example, manage the data and make sure that our data is secured, and make sure that our privacy is protected. So I think people have that kind of habit, or that kind of underlying belief in their mind. So then now, if all of a sudden you tell them, okay, so actually you can own your health data, and you will be a custodian of your health data. If you lose your private key, you will never be able to access your health data forever. I think people will be paranoid. Yeah. And for probably some like young people, or like forward-thinking people, or like experimental people will think, okay, it's cool, I will try that. But a lot of, let's say, older people, right? That just sounds very bizarre to them, right? And probably they are even worried, do I have the ability to manage my healthcare data? What if I lose my private key? Like, I'm not very technically savvy. So do I actually have to get the help of my son or my daughter every time if I want to visit a doctor, so that I can share my data with the doctor? So I think there is also this kind of not resistance, but kind of unpreparedness of consumers or patients to adopt some of the blockchain-based healthcare applications. So there are of course there are also other reasons, but I guess these three reasons probably touch upon the core of why blockchain is not being adopted very quickly in healthcare.
Right. Yeah, I can totally see all of that. In terms of the healthcare data being held in our own private wallets, I'd say it's kind of similar to cryptocurrency and people having control of their own finances as opposed to it being stored in the bank, right? And I think it's kind of the same mindset shift that we need to happen for people to say, actually I'm in control. And if I lose the password, I literally lose everything, right? Like, and I guess that can be tough for some people to kind of reconcile with and adopt for sure. And then the other piece you mentioned about these different, entities within the hospital, they're all kind of, like self-interested maybe. And then, these blockchain innovations, they are really systemic changes, right? The entire system, entire industries need to shift. And you need to get everyone on board because these blockchains have a big social aspect to them as well, right? And then you combine that with regulatory hurdles in an industry such as healthcare that's very heavily regulated. I can see it be very difficult to get that.
Given that healthcare is heavily regulated, and there are a lot of government influence, and physicians have a lot of power in this sector, if we really want to get blockchain adopted, I think we need to get the government and the physicians on board first. If there's some kind of top-down efforts or initiative from the government saying, we need to experiment with this technology to see if we can develop a blockchain-based health record management system or something like that. If the initiative comes from the top, I think that will make a huge difference. But if you don't have the buy-in from the top and you just start, working on the ground and trying to do some incremental innovations, it's going to be very challenging.
Right. So you almost need like lobbyists or something to kind of make this thing happen. And that's how you would solve that regulation issue. What about the problem of people being hesitant to control their own data? Like how can you help push people over that barrier and make them realize that it actually is an empowering thing, that these institutions that we trust to secure our data have historically done a terrible job of it, right? Like how do you make people understand that it's better off in their hands?
I think it will come with education, like the jobs that you guys are doing right now. And I think people need to realize that even though right now the doctors or health authorities are keeping their health data, it's not the most efficient way. And also, there have been data breaches, and sometimes there are privacy breaches. And they need to recognize that, and they need to feel that there is a necessity for themselves to own their data. But at this point, I don't think a lot of people realize that. A lot of people still, I think, especially in Canada, I think most people still very much trust the health authorities, trust the established system. Because by and large, the system works. Even though it's pretty inefficient and it's expensive for taxpayers, but for most people, it works. Right.
You go to the hospital, you have something wrong with you, they fix you up and send you on your way, and
so you don't think much about whether there have been privacy breaches or security breaches, and whether there will be advantages for me to own my own data, right? So I think people need to be educated first about some of the downsides of letting the authorities own their health data, and also we need to design some kind of incentives mechanisms in the blockchain-based apps to incentivize people to share their data, to own their data and share their data with others. And in some of the applications I just mentioned earlier, there will be compensation mechanisms. So if you share, if let's say you become the owner of your own health data, and you can share that with pharmaceutical companies, with research groups, every time you share, you will get a compensation. So I think with that, maybe a lot of patients or individuals will be more willing to own their record and to share the data, because basically you can simply make some money. Yeah.
Yeah. Everyone loves money, right? At the end of the day. You said that there's not too many of these healthcare blockchain startups that have been successful. Are there any, like maybe a couple on the top of your mind that you think are on track to actually, realizing their vision?
Yeah. So I think the most prominent startup in the blockchain healthcare space right now is Consensus Health. They have changed their name 2 months ago, and they used to be a subdivision of Consensus. You know Consensus, right?
Yeah.
So the company in New York City. But then they kind of separate themselves from Consensus, and they establish a new entity, and they changed their name from Consensus to a new name. At this point, I couldn't remember the name, but
we'll look it up. We'll figure it out.
Yeah. So they are probably the most prominent startup in the space. They've got probably the most experienced people, and they have a very wide range of stakeholders participating in the network, and they are talking with many different investors. And they are very ambitious. So they have, I think, 2 solutions that are under construction. And the very ambitious one is called federated learning of health data. So that one is basically to combine blockchain and machine learning. So basically, it's like we would take individuals or research groups. We would take health data from individuals or research institutions or pharmaceutical companies, and we will collect those data in a space. Whether that space is a cloud or it's a IPFS system, but that in that kind of space you will have all the data, but then the data is anonymized. Then you can use machine learning, use AI to mine the data and generate some findings and results, and then you can send the results back to each individual data contributor. So that's particularly useful for pharmaceutical companies because pharmaceutical companies often have to do their clinical trials separately, and clinical trials are very expensive, and they could actually collaborate with each other and can leverage on each other's sample, so that it could have a bigger sample, and probably they could develop the drugs much faster. So pharmaceutical companies will really be benefit from that idea, and that idea is technically fancy, combining blockchain and federated and AI. And when you combine those 2 ideas, so you will get the benefit of data aggregation from individual data owners, but then you will also protect their privacy, because you only mine the data in the kind of like the collective space, right? And you only send the results back to each individual data contributor. So each individual data contributor wouldn't know the raw data of another contributor. So I think that's something that they are working on right now, and I think they are also working on a blockchain-based electronic medical system, electronic record system. So if you go to their website, these ideas are listed there, but I'm not sure how far they are on a journey, because I haven't seen a prototype or a demo yet.
Okay.
Yeah, but they are already kind of like the top startup in the space. And then the second company is called Hushed Health, which is based on Nashville. And the CEO, John Bass, he has been a very strong advocate of blockchain healthcare, and he was a leading kind of figure in the space in the past few years. And they have pivoted the business several times, I think in the beginning they were focused on blockchain-based medical record system. And then they realized that was probably very difficult to do. So they pivoted towards blockchain-based credentialing system to manage the credentials of medical professionals. They thought that that could be a low-hanging fruit, and but now if you go to their website, they also don't mention medical credentialing anymore. They have become a venture studio. So it's a venture studio that fosters blockchain-based healthcare innovations. Yeah.
Okay.
Yeah. So even though it looks like right now they are not doing a specific user case, they are still much active in the blockchain healthcare space. They are probably trying to become the enabler of innovations. Yeah. Yeah. And these two are probably the most prominent ones right now. Yeah.
What do you think they're doing that makes them prominent and that they haven't failed so far? Like, are they doing something different than these, thousands of companies that have fallen before them?
Well, that's a very interesting question. I think the reason why they are able to persist is because the founders of the companies or the senior leaders of the companies are very experienced and strong. So they are able to keep getting funding, and they are able to constantly look for new ideas and pivot to new directions. And I think they are probably still at the accumulation stage because they haven't really realized a particular product. But they have the resources and abilities to support them to continue to experiment, to continue to accumulate.
Mm-hmm.
Yeah.
Okay, makes sense. I'd like to maybe pivot away from the healthcare specific focus for 1 second and talk about how we can go about helping people to better understand and learn about this stuff and help to onboard people into blockchain, because that's Blockaday's mission, is to take this very complex, overwhelming topic and break it down and help people understand what this stuff is and how it actually can benefit them. Because, based on this conversation, there are lots of ways that if this stuff is adopted in healthcare, for instance, it can empower individuals, mm-hmm. right? So that's kind of Blockaday's mission. I think healthcare is a really cool use case to show for that. So do you have any ideas of how we can help get people into this space, either like Blockaday specifically or just in general? How can we help people realize that this stuff is important, that it is starting to become a part of many industries, that it does have benefits for billions of people? How can we help people see that?
Well, that's a very interesting question. So I just mentioned that the healthcare field is generally very institutionalized and regulated, and it has a very risk-averse culture. But in that sector, I think there are also some risk takers. Very few, but there are also a few. That's why, in some conferences, I've seen doctors, practicing doctors that are trying to, do some, trying to kind of create blockchain-based applications. And I think to get more healthcare people to join the blockchain space, probably we need to first target at those risk-taking individuals, and work with them first. Probably co-produce some education materials with them, and invite them to podcasts or knowledge exchange activities, and they are like the small centers, right? So if you engage them and you kind of educate people together with them, they could probably help disseminate the materials that you build into their circle, and I think by bit you will reach to a broader audience. Yeah. So I'd say probably the best bet is to get in touch with those kind of more risk-taking experimental individuals, whether it's doctors or nurses or scientists or government officials, and get them on board and try to develop education materials with them, and then try to generate a ripple effect. Yeah.
Okay. Yeah, and that makes sense. Start with the people who are, already starting to think about this stuff.
Yeah.
Partner with them, and then you kind of amplify your reach that way.
Yeah.
I was just reading today, I saw about IBM is apparently working with like the CDC or the Center for like Disease Control, and they're trying to use blockchain to like track disease outbreaks. Do you know anything about that?
I know that IBM has been working with the government for a while, and they do have a very strong blockchain division. But I'm not really familiar with the recent use case that they're doing in terms of like disease tracking disease. And that's very interesting that you mentioned IBM. So like IBM and Microsoft all have their kind of blockchain arm, and that actually makes difficult for some small startups to rise above the water, because in healthcare, as I said, it's highly regulated, right? It's very hierarchical. It's very top down. So even if, let's say, the government, let's say in this case CDC, wants to do something about blockchain, they want to exploit a blockchain use case. Like if, let's say, you are the government, right, and then there are, let's say, IBM and Microsoft, these kind of established companies that have very strong capabilities, a history, and then there are a group of startups that probably haven't really demonstrated any product yet. Who would you want to collaborate with? To do a pilot project, right? Of course, as a government official in the healthcare sector, you want to make sure that every decision you make is safe, right? So, probably you will go with Microsoft and IBM. Yeah.
Poor little guys can't catch a break, eh?
So that's actually one of the other reasons why, mass adoption of blockchain innovation in healthcare is difficult. I actually mentioned that in one of my reports. And I call that as the lack of ecosystem building efforts. So the big guys are not really kind of collaborating with the small guys, are not really helping the small guys grow to create a ecosystem of blockchain services for healthcare. They are pretty much on their own. And because of that, the small guys struggle with funding, with technical abilities, with network, and with resources. And then over time they will just be wiped out.
And the rich keep getting richer, right? Okay, we'll wrap this up pretty soon, but one more question I want to ask you. What does the next, maybe 6 months or a year look like for you in terms of your blockchain research or your involvement in the space? Like, what are you doing next?
Oh, that's a very interesting question. So, I have a couple of projects going on right now, and actually one of the projects is to continue to experiment with the idea of a blockchain-based health wallet, and to explore if there are some creative ways that we can actually get some initial buy-in from whether it's patients or doctors or pharmaceutical companies. So and that's something that probably I'm going to explore together with Dr. Victoria Lemieux in the next while. And in the meantime, I'm also interested in blockchain applications in education. Because after all, I work at UBC as an educator. So, and I really think that blockchain probably can make a difference in education. For example, we can create decentralized education platforms. And so that would be something that I think I will look at as well.
Awesome. Well, excited to see where you go from there.
Yeah.
Thanks so much, Dr. Lu. Really appreciate you
Thank
being
you.
on the show.
Thank you for having me.
And thank you all of you for tuning in and watching. Remember to like, rate, review, subscribe, press all those buttons. If you enjoyed the podcast and we provided some value for you, share with your friends and get the word out there. Thanks a lot.
Thank you.
Awesome. What do you think? Sweet.